Off with like a
Mhm.
quick introduction. So my name is Veer. I'm a junior in high school, and I'm the kind of the clinical lead at Orphan Access Initiative.
My name is Arush. I'm also a junior, and I'm the finance/economics lead at Orphan Access Initiative.
Okay.
Could we perhaps get a little introduction for you?
Yeah, sure. So I'm Dr. Alicia Campbell. Um, I recently graduated with my PhD in molecular cell biology and neuroscience from Rowan University, specifically at their School of Translational Biomedical Engineering and Sciences. I also, for undergrad, I went to Penn State, so I did biochemistry, molecular biology there. I've always kind of been in the research space, more so in rare disease research now than I was previously, but overall trained as a basic scientist, and I'm kind of going from basic science now into more clinical research.
Got it. And what drew you first to the medical field in general?
Yeah. I think so I always liked science, but being able to understand the science behind patient care, I think, is really what drew me to medical, biomedical, something where I could be at the bench actually doing experiments, but it had a real world impact on an actual patient population. So kind of getting the best of both worlds without necessarily actively seeing patients every day. But I kind of get the best where I get to see people that my research affects, as well as doing science in a lab. So, kind of the best of both, I think. But I've always been interested in maybe more the science aspect of medicine. That's kind of what drew me to doing a PhD, doing biochemistry, that kind of thing, rather than, I guess, the traditional medical school route.
And kind of building off of that question, what kind of made you wanted to specialize more in rare diseases and focus more on rare diseases?
Yeah. So, um, within my first, I think, year of the PhD, it was presented to me to kind of continue a project that had started in the lab prior to me joining with this disorder, Med13L syndrome, which I'm sure we'll talk a bunch about. I had an opportunity to collect patient samples from a group of individuals. So I was able to kind of meet these families, and it really created a sense of urgency because there's no care or treatment or anything available for these families. And that kind of helped me open the door into rare disease spaces. Um, a lot of times in rare disease, since you know the families personally, or you've met patients, things like that, it kind of creates a sense of urgency because you see the day to day of these families and you want to help in any way that you can. So, the way that I was able to help was actually collecting patient samples. So through a small biopsy of the upper arm that I grew out into cells and stayed in the cell biology kind of realm, and then eventually transitioned more into clinical research where I'm looking at different genotypes, what their symptoms are, that kind of stuff. So just being able to see the actual people that your research is affecting, I think is probably the most enticing thing really about it. Especially as somebody, I don't have children, so I don't really know anything about having a child, but getting to learn from these people who have children who are affected is really meaningful.
Mhm.
And then going into Med13L syndrome, could we possibly
Mhm.
get a small introduction without going too in depth about what it actually is and how does it affect patients?
Yeah. So the kind of overview that I always give people without going too much into the science is just that it's a rare genetic neurodevelopmental condition that is a spectral disorder. So you could have very, very mild symptoms, very severe symptoms, very similar to the autism spectrum, where we have um, individuals on one side, the other, sometimes in the both. Common features for Med13L specifically include developmental delay, intellectual disability. We also see a lot of issues with speech, with the ability to produce speech, language impairment, and then also more on the musculature side, we see things such as hypotonia, which is a lack of muscle tone. So the children will tire easily. They'll be able to run around for a little bit, but then they'll tire easily. So you see kind of this motor neuromuscular side of it, but then also the nervous system side of it, where we see intellectual disability, developmental delays, that kind of thing. So just a rare genetic disorder.
Hmm. And also with like a lot of rare disease research, I think Arush and I have also seen a lot of it starts with kind of describing the condition first. And we looked into your research, and a lot of it is about understanding the causal mechanisms. So
Mhm.
for the audience that can watch this recording, kind of what's the difference between the two, and why are both important in their own way?
So in terms of figuring out, I guess, the set of symptoms, first of all, a lot of times when people get this diagnosis, and many rare disease diagnoses to begin with, there's no information out there. So a physician will get a genetic report. Most often than not, physicians will Google said gene, to try and figure out what's known about it. A lot of times there's not anything actually published. So it relies on researchers to kind of go through all of the known literature and compile reviews, that kind of thing. But you also run into cases where you don't have that at all. So physicians are kind of struggling to figure out, how do I help this individual that has this new diagnosis? So kind of establishing a set of known symptoms or characteristics could help with getting access to programs at school. So whether they need an IEP, they need advocacy in the classroom if they are school age. Having that set of symptoms and known characteristics is probably the most important thing first, so parents know what to expect and they know what to seek out help for. So when they go to the pediatrician, they actually become the experts on the disorder, because a lot of parents will Google, what is this gene? What does it do? So they'll go to their pediatrician and say, hey, I read online that we need to do speech language pathology. We need to do a nervous, maybe like a CT scan or an EG or something like that. Um, so understanding the symptoms, I'd say, is probably the biggest. But then where I kind of come in is not just that, but understanding what's happening at the cellular level. So what's causing those symptoms? And so my work is on mitochondrial dysfunction and mitochondria. I'm sure anybody who's gone through high school knows that the mitochondria is the powerhouse of the cell. Hopefully everyone's heard that or seen a meme somewhere about it. It definitely is true. It performs a lot of roles in the cell. So you can imagine, especially in tissues like the brain or your muscle or something like that, where you need a lot of energy, you need that powerhouse. If you don't have the mitochondria functioning to their optimal energy production, then we're going to have issues, and we'll have things like decreased muscle tone. We'll have issues like CNS related, so nervous system related. So understanding kind of what's going on inside as well as outside, and then that creates a whole picture. So I've kind of had experience creating both of those and then putting them together.
A disease that affects around 1.6 per 100,000 newborns. How hard was it in your research just finding previous cases to go off of and just looking back to refer at anything?
Yeah. Incredibly difficult to start off with. The publications, I would say there were about 20 to 30 at the time that I kind of started, which is around 2022. I would say since then there have not even really been that many more. So even a quick PubMed search, there's still not a whole lot of peer-reviewed publications that are out there, the majority of the information actually comes from the parents and the caregivers. So finding ways to access them through organizations, through the patient advocacy groups, is probably the easiest way to get information about symptoms and kind of like the day-to-day lives of the individuals, just because it is so rare. And I think we're at maybe only a couple hundred identified worldwide. So, again, every single little piece of information that you can learn, whether it's from a peer-reviewed publication or an actual parent that sees the kid day to day, is useful information no matter if it's coming from PubMed or a parent. So it's incredibly difficult to find, and I think the same goes for all rare disease. It's really finding the parents that are out there trying to advocate for their children that is the most useful information.
In rare
And
diseases, oh, Very got it.
so a lot of like researchers, they often rely on published literature and clinician reports only. But what do you think they're missing out on by not really relying on like patients or their parents who kind of have that personal experience?
Yeah. So actually we've done specifically for Med13L, there should be a publication coming out soon where we looked at caregiver reported, or parent reported versus actual peer-reviewed clinician reported. And there's a huge discrepancy, between things that are more you would only see at home type thing. So for example, sleep habits. If the child has a lot of issues with sleeping, that's not going to be something that presents in a doctor's office. So finding those types of issues. So we see a lot of issues with sleep. Communication is something that maybe the child isn't actually communicating at the doctor's office, so the clinician doesn't report it. But maybe doing a comparison between parent reported, caregiver reported, and actual clinician reported is something that would be useful for no matter what the rare disease is, to kind of figure out what the discrepancies are. And there's some fun statistics that you can always do. You can figure out what the actual statistical significant differences there are in reporting stats for those type of symptoms.
For rare diseases in general, there's such a, especially for something like Med13 now, there's such a small patient population where a lot of economists, they say that it might not be worth it with such a small patient population. There's not much return there because in the end of the day, healthcare is a business, unfortunately. What do you see, like what are the ways we can combat this?
Yeah. So I think from a researcher perspective, trying to figure out almost the most bang for your buck because it is everything's a business. So maybe trying to figure out if you're looking at therapeutics, what therapeutic specifically can help multiple rare diseases. So if there's something like what I work on for mitochondrial dysfunction, that's well known to affect a bunch of rare diseases. So almost all of the autism related, anything that's nervous system related, if you look close enough, there's something to do with mitochondria there. So if you develop a therapeutic that is not going to just target one rare disease, but you can sort of advertise it to combat multiple rare diseases, it kind of catches the eye. And that's how you sort of get investors interested in the work that you're doing is you advertise it not just for, 1.6 in every 100,000, but you advertise it for this affects 20% of the population or something like that, a lot broader of a bandwidth for the therapeutic or whatever you're trying to target. So, advertising your work and advertising what you're trying to do is actually a skill that you sort of develop in the rare disease space because you have to make people interested. And a lot of times, stakeholders will say that exact same thing that why should I care? This is only a couple hundred kids. But if you pull that together, you put a couple hundred kids times however many rare diseases you want to focus on, especially if they have similar mechanisms at the cellular level or similar symptoms, something like that. That's how you make it more marketable.
Is that
Uh,
something you're forced to keep in mind while researching and developing new therapies? Is that kind of like a barrier for you in many cases?
It definitely is. Um, I would say the majority of the grants that are written, the majority of the proposals that are written have that common theme to them. You always put something down at the bottom that says, not only does this help one specific disease, but this helps X, Y, and Z. So you always are trying to market what you're doing. And it's definitely something that maybe is not common for most researchers because they're researching something like cancer, or neurodegenerative diseases, that kind of thing that affects so many people. But in this space, you get used to advertising and kind of advocating for yourself as a researcher, saying that, hey, my work is relevant, because it can affect more than just one small population.
and since we're on the topic of barriers that researchers, especially in rare disease, face, can you elaborate more on like some of the other challenges that like rare disease researchers specifically face, like including what we were just talking about?
I would say the number one barrier that we face is funding. Um, there's a lot of science that's progressing, but just getting people to kind of bite, is one of the most challenging things. Not only that, but say you have an important discovery, it's making sure that stakeholders stay interested. So making sure that you're producing updates every so often that have kind of little advertising pieces as you go along, that we've discovered this, we need more funding to continue through the next however many years. So there's a lot of promising projects that come out that unfortunately don't move forward because the funding is limited. People, they don't have a salary, they don't have supplies, so they kind of have to move to wherever the job is, at the time. But I would say the number one barrier is definitely funding, securing it. But I'd say on the kind of brighter side, there are a lot of new federal organizations that are starting to support rare disease. So if you've heard of NORD, NORD is the NIH's rare disease portion. Um, there are a lot of up and coming funding agencies for rare diseases because I think that we're starting to recognize that it is a valuable, asset to have in terms of funding in the scientific community. So there is a little bit of a bright side that people are starting to recognize rare diseases a little bit more now, especially because we have more science to discover what's actually going on. So the more that we have sequencing, for example, the more that we're going to figure out people have all these rare diseases that we never even thought about before. So as we advance our science, we almost have to advance the funding in some way. So it is a little bit challenging, but there are bright sides to it.
Definitely, yeah. What about on the clinical side? What's the biggest barrier?
Um, I would say, and it's probably a cliche answer, but just the small population of people. Um, Especially when it comes to describing sets of symptoms or clinical trials, because you have every single person is a single data point, and that data point might be completely different than another data point of the person who has the exact same disorder. So once those data points start to pop up, it makes it difficult to collect, I guess, robust or rigorous data because there are so many discrepancies between patients, when you have such a limited number. So when you have an N of only a couple hundred, then just a couple here and there actually might be significant, but you don't know unless you collect a lot more samples. So I would say clinically, having the more individuals is probably the biggest, thing that slows progress is not having enough people.
Hmm. And I think we touched on this a little bit with the organizations that are starting to increase funding for rare disease research. And we were kind of thinking a big part of that is awareness as well. Like a lot of people may not even know about how many people have rare diseases around the world. I believe it's around 300 million around the world. Um, so for an organization like us, which is trying to bring awareness to rare diseases, what advice would you give to newer organizations that are trying to establish credibility and make a meaningful contribution in kind of the rare disease community?
Um, I would say probably the easiest thing to do is to make information accessible to all parties, because I'm sure you know that so many people come from different education backgrounds. So making not only the healthcare, health equity, more economic language able to digest by a population that maybe is hardcore scientists. So kind of like whatever language your expertise is in, bringing that to a level that all people understand. That's one of the things that I kind of try and help do in science communication is bringing bench science to bedside, such that hopefully anybody's able to understand what I'm trying to convey, even though there's probably really complex biology or maybe really complex economics behind healthcare equity and that kind of thing. Um, but just being able to translate maybe at a higher level down to a level where every person could understand is a really good way to advocate. It also brings maybe perspectives that people hadn't seen before. So every new person that's in the rare disease space is going to bring a new perspective. So especially if you're coming in with maybe an economic background or you're really interested in economics. Maybe that's not something that rare disease communities really think about. So there's always unique perspectives to bring in. So I would say just making sure that everything is translatable, that people understand. But also don't assume that the value of skills is only in the laboratory or clinical settings. There are communication skills, there's advocacy, there's policy, economics, that's all important to creating a giant rare disease community. So it's not just science, it's not just clinicians, physicians. Everyone, regardless of their perspective, could contribute to understanding. And the more people you have involved, the more perspectives. So I would say for people who are getting into rare disease, bring your perspective to the table.
That's great advice. And one more question kind of about this topic is when conveying or like making the scientific information accessible to families, how, do you recommend any formats or ways of conveying it without oversimplifying it, but still
Mhm.
like without needing to kind of teach every single detail?
Um, I would say the best way to create useful information is ask the parents first. Ask the parents, what do you know already? What are you looking to understand? A lot of times people don't have the expertise in genetics. People, yes, you've heard of DNA. Yes, you've heard of what a gene is or something like that. But being able to describe that is a little bit challenging if you haven't gone beyond just high school biology. Um, so ask the parents, ask the caregivers what they currently understand and what they'd be willing to try and understand. Then from there, you can actually focus on creating information, and creating maybe I like little flyers, is one of the things that I've worked on. If you've heard of
Yeah.
Canva or BioRender has a lot of figure making, especially for science, where you can create some nice colorful images that kind of break down maybe what things look like inside of a cell. So being able to see what DNA looks like, what the nucleus of a cell looks like, might not be what people are used to hearing about or even really interested in hearing about, but understanding where they're at and then bringing everybody kind of up to speed is normally how I go about, especially when I give seminars. I've given like a genetics 101 seminar, and I'll start at the very beginning and I'll say, this is a cell. We have trillions of these in our body. Just assume that we are starting from absolutely nothing. And if they want to tune out until they we're at a speed where they are understanding, that's fine. But you have to assume that there is no knowledge, and then you can sort of bring people to where you're trying to get to. But always ask, and people will, especially in rare disease, they will always offer up anything that they can because they just want, most times, they just want to help either themselves or their child. So they're always willing to give information.
All right. We'll keep that in mind.
Mhm.
Adding on to this humanizing approach, would you say that working with kids specifically has amplified the emotional side of being a healthcare professional?
I would say definitely yes. The first time that I interacted with kids who had Med13L syndrome, it was very eye-opening, especially because I always give the story that up until that point, I had only known the kids as little vials of cells. I hadn't known what they looked like. I hadn't known what their first name even was. They were all de-identified to me. So being able to put a face to that little tube that I'm holding is always kind of heartwarming. But pediatrics, it also makes it a little bit more emotional in a way because it's such a young child that you want to help as quickly as you can before they're getting maybe to early adulthood where they're starting to need to be independent. You kind of want to get everything figured out as quickly as possible. So seeing a young child that needs help that maybe can't walk or can't even speak, you kind of want to like rush. There's a sense of urgency to help in any way that you can with your research. So pediatrics is definitely always, people always say, is one of the toughest ones, um, is seeing children that need help. Yeah.
How important is mental health for you and other professionals dealing with kids and hard diseases like this?
It's definitely really important. I would say mental health, regardless of profession, is everybody loves mental health as they should. And it's a lot more forefront now, I think, in most people's minds. Um, and making sure that you have access to mental health resources. A lot of healthcare professionals, regardless of where you're at, will have some sort of mental health service that you can actually use. So whether it's free counseling sessions or in my case, just even talking with my peers, talking with mentors, talking with other people who are in the rare disease space is a great way to kind of have an outlet saying like, hey, I saw so and so today. This was really emotional, but being able to kind of talk to people who also are going through the exact same thing is definitely a huge factor in kind of making sure that your mental health is okay as well.
So, as we know, rare disease research continues to progress as time goes on, but it's still a very prevalent thing around the world. So, we were wondering what gives you optimism about the future in rare disease research as a whole, but also specifically for Med13L syndrome.
Yeah. So recently, I would say in the past maybe year or so, specifically for Med13L, we've gone across borders. I've actually had the opportunity to travel to France for an international meeting for Med13L syndrome specifically. Um, Being able to communicate with other countries countries and figuring out those populations that are maybe not even represented in our current literature or our current studies um, gives, I think, a lot of researchers a lot of hope because we're able to connect with people across the ocean. And now with things like social media, that is our best friend in terms of figuring out if there's a patient population in another country that we're not even aware of, and having online resources. Also, in terms of advocacy, being able to present in multiple languages is something that the Med13L Foundation has sort of started to work on. So their website that they have, they actually had it translated into a couple of different languages, such that anybody from any country worldwide could tune into what the United States is doing in terms of our research. So it definitely is hopeful that there are researchers out there that we might not even know about until we connect with them online, or through reaching out. You see a publication from another country, you reach out and establish a connection. So there is a lot of interdependence, especially in rare disease, because the populations are so small. So whatever we can get from another country, scientists, researchers, clinicians are always willing to share. Just because we're helping them as much as they're helping us. And it also, I'd say, I was actually worried that I wouldn't be able to, that there would be a language barrier between myself and other countries. But I would say that the majority of the researchers that I've spoken with overseas actually speak English. So I'm able to understand that and French. I started learning French from a young age, so I was able to communicate fine in France, but kind of getting rid of language barriers such that we can communicate both science and policy anywhere in the world gives a lot of hope to the rare disease community.
How does the rare disease ecosystem in the US compare to other countries?
In terms of research, I would say comparing at least within Med13L and closely related neurodevelopmental disorders, that the United States is probably maybe 5 to 10 years ahead of where other countries are. And I would say that the biggest challenge for other countries is their funding systems. So it's a lot trickier to get funding from government agencies abroad. And it's a lot trickier to get actually access to patients, and access to information about patients. It's a lot trickier abroad than it is in the United States. Whereas in the United States, if we just de-identify patient data sets, or if we have things like IRBs in place, it's a lot easier to access patients. And I think that's probably why we're a lot further ahead than other countries, maybe. But it could also just be our state of funding. If we have more resources to allocate towards rare diseases and basic science, even than other countries, it kind of puts us a little bit of an edge over others. But yeah, I would say maybe a little bit ahead.
Mhm.
And this is kind of for the patients, specifically. How would like their healthcare system, depending on the country they're in, how would that how would the challenges differ in depending on the country for a rare disease patient today?
Um, I would say it's a lot, from what I've seen, it's a lot more challenging abroad, in terms of recognition of an actual disorder, and then getting appropriate care, specifically for school age children. For example, in the United States, we have easy ways where a physician can provide a certain report that they then can take to the school board, obtain an IEP, obtain whatever special education requirements there are. We have things in place in the United States. In other countries, it's a little bit more challenging. Whether it's a diagnostic code from the physician, I know we have set certain diagnostic codes that we can use in the United States that maybe don't carry over internationally, but maybe if there's a way to create an international system of diagnosis codes, such that we can kind of help out other countries, that would be a valuable asset. I know a lot of rare disease organizations work on getting a diagnosis code. Otherwise, they are just kind of put into the bin of autism, intellectual disability, psychiatric, that kind of umbrella, rather than having a specific rare disease diagnosis code. So that's something that could help in the future, is helping organizations create diagnosis codes.
I wanted to ask more about kind of the organizations and foundations that raise awareness and also raise funding for research. So, what would you say the most effective ones or most successful ones are doing differently than others?
I would say having a set of dedicated professionals. A lot of times it is parent run, but people who are willing to donate a lot of their time to create kind of a hierarchy, leadership structure. You also want to create clear goals. So whether that's you have a strategic aim that you want to kind of go after first, prioritizing what you want to go after. So making sure that you have clear goals and a strategic focus. And that really does take a whole group of people kind of sitting down and figuring out what we need to do first, what we need to do second. But the more people you have, like I said earlier with perspectives, the more partnerships you have, the more collaborations you have. So you have people who are maybe in biotech startups who actually have a kid with a rare disease. And then you kind of add in that perspective, having a group of dedicated individuals make the organization, I think, stand out, just because they're able to get more done. They have a lot more time spread across multiple individuals. Um, that and then being able to establish relationships with scientific organizations, institutions, universities, if they're willing to kind of commit to a university or a lab or something like that. Normally, labs at universities are the cheapest way to actually get research done, rather than going to a contract research organization. It's a lot easier to build partnerships by just sending an email to somebody who maybe works closely or maybe doesn't work on the rare disease directly, but could work on it in the future, and you really like the way that they present their science or something like that. They're always an email away. So I would say establishing those connections with scientific community, setting up a scientific advisory board is also something that's really useful. A lot of strong organizations will have healthcare professionals, clinicians, researchers all come together to make decisions about where to go next and what to prioritize in terms of research. And that really helps get things going because you kind of weigh the pros and cons of different areas of research and decide where to go next. So it all comes back to having clear goals, though, and having people who are willing to dedicate their time.
Whether it's communication or just in general, what are the biggest stigmas in rare disease that you want to break?
Um, I think so. A lot of times with rare diseases, there's something neurological or there's something intellectual, developmental that is affected with the kids. And one of the biggest things that I try and break the barrier with is that just because a child is not able to actively communicate doesn't mean that they're not capable of communicating. So we've worked a lot with speech language pathologists to understand, specifically for MEN13L syndrome, that just because a child isn't able to communicate doesn't mean that they're not capable of complex processing, of understanding what's going on. So a lot of times you see a child with different needs or differently abled, and understanding and getting the public to understand that just because that person is not able to actively communicate, does not mean that they're not still processing, they're not still understanding what's going on. They just don't have the means yet to produce any sort of communication. So understanding that they are important just as much as the parents, but that each individual, whether they're mild symptoms, really severe symptoms, that every single person is an individual as well, and they're all important as part of the story. But I think one of the most important things that I focus on really is just the fact that sure, they're not able to communicate yet, but maybe they are still understanding what's going on, and to kind of not count them out, that maybe look into alternate ways that we can communicate with the patients themselves as well.
Yeah, I think that's also really important considering like how rare the condition is. The patient with the condition may feel like excluded from others. So it's really important to make sure that they know they're that they can fit in with everybody else as well.
Yeah, yeah.
So I kind of wanted to touch more on your work with Med13L syndrome. So are there any like unanswered questions or research questions that uh, are your primary focus as of now?
Um, I would say with the basic scientist training that I have, I'm always going to come at it from a perspective of understanding what's happening at the cellular level, and then moving up through the human body and up through what's happening with an individual. So I kind of come at it the opposite than a clinician does. So for Med13L specifically, understanding the complex biology that's maybe failing or something's going wrong at the cellular level will always be at the forefront, just because that's a highly targetable area for therapeutics. So whether it's repurposing drugs that are already FDA approved, it's a lot easier to go at it at the cellular level, start there, and then work your way up, rather than trying to just treat symptoms. So I always kind of see it in a scientific lens, and I'll always see it that way. But I would say there's a lot of questions that are unanswered, and that will probably be unanswered for a while, since there are very few researchers who do work on Med13L syndrome. There's also a lot of funding gaps, so finding funding to actually support lab activities is pretty difficult. But I would say a lot of the basic biological questions remain unanswered. So just because we have a mutation in a gene, what does that actually mean for the cell? What does that mean for the organism? You can kind of work your way up through even the organ systems, is probably the biggest unanswered question. We have a lot of answers about symptoms, and what happens with certain individuals as they age. We do have a lot of information about that, but actually understanding the biology behind it, there will always be unanswered questions, I think.
How scary is that uncertainty when you're dealing with such a small patient population?
Um, I wouldn't say I wouldn't say that it's necessarily scary, probably because I see it as, I guess, just being in the field for a while, I see it as an opportunity. Um, because there are so many questions, there's a saying in science that a good hypothesis leads to so many more hypotheses. So even though you answer one question, if it's a good question, it's going to lead to X number more questions. So you could honestly say that the science is good science because it's creating even more questions. So I would say necessarily that it's not really the uncertainty of it. I think it's actually more of an opportunity because there are so many unanswered biological questions. Um, it creates opportunity for a lot of different researchers. Whereas on the clinical side, if you're looking at it kind of top down at the patient, we have very easy ways of treating certain symptoms. So, if you have epilepsy or seizures, we have known drugs, we have ways to treat that. Um, so we're kind of able to manage and handle the individuals on the day-to-day basis. But there's a lot of opportunity on the biological side of things that I think is more opportunity than it is scary. But I guess maybe more scary for a parent than it is for a researcher. I could definitely understand that as a parent looking up, trying to look up research, or trying to look up any of the biology, that it would definitely be concerning seeing that there's only X number of publications out there, or seeing that there's only maybe one or two scientists worldwide that work on it. I could see that as definitely alarming.
Definitely, yeah, I didn't think about it that way at all.
Yeah, there's
Yeah,
a
that's definitely it. The
mhm.
scientific mind is that there's always more questions to answer. But I'm removed from it in a way that I'm not a parent with a child that has the disorder. So I'm a little bit removed that you could say that my judgment is a little bit different than a parent's.
Mhm. And I wanted to ask, this is kind of for kids around our age or students around our age. So are there any gaps that you see in the rare disease community or ecosystem that students can like realistically help to fill or make a meaningful impact on?
So I think I've said it a few times now, bringing fresh perspectives. Um, and also energy and the passion behind it creates long-standing relationships. So starting at such a young age really helps kind of form the collaborations early that maybe work all the way through, if you end up wanting to go to medical school or something like that. That's something that will carry with you all the way through. So having the passion early on creates lifelong interactions with people. But I also think that especially younger investigators, you might be exactly at the level of education that many parents are. So, in terms of a high school education, that's actually what most researchers assume that parents have. So, everybody's heard the whole mitochondria is the powerhouse of the cell. I'm sure you guys have painstakingly heard it probably in high school biology if you've had to take it. But you are right at that level of education where you're able to communicate and translate your scientific knowledge into accessible language. So you are at the peak educational level, if that makes sense. Um, and also, I think with younger people as well, I talked about social media earlier, having the ability to use social media is something that the older generations are not well versed in, that are they're averse to it. They don't want to log in, they don't want to do anything on their phones. Um, but coming at it from a younger perspective, and I'd like to think that I also am still part of the younger perspective, being able to use my phone. Um, but creating ways that and educational resources that are up and coming that the future generation of leaders, scientists, researchers, it's kind of all transitioning to social media now. So you have that unique perspective as well.
What are the cons with social media that you've seen as a medical in the medical field, especially with AI now?
That could be an entire hour-long discussion in and of itself, especially with the current distrust that there is in science, and in medicine. Under the current government, we have a lot of challenges in the scientific field with kind of combating what is being spread about science and that it's not trustworthy, that medicine's not trustworthy. So we're kind of setting ourselves back a little bit in terms of scientific advances, and especially funding too. So you could say that social media is a very easy way for misinformation to spread. Especially, I'm sure if you guys are on like TikTok or something like that, you scroll through and you see somebody who has um, you can take X, Y, and Z supplement and it's going to help with neurodegeneration. It's going to solve Alzheimer's or something like that. There's a lot of advertisements and misinformation that's out there that's not scientifically backed, that it's just so easy to spread. I would say that's probably the biggest con is how quickly things can spread without people who are actually, it's not evidence-based backing it up. And there are no peer reviews behind it. It's just whatever people click on and share. They believe is true. They believe whatever's on the internet is true. In terms of AI, I actually think that there's a difference between my generation of scientists and prior generations where they don't really want to accept that AI is almost at the forefront of what we're doing in science. It could really help with the day to day, as long as you are able to go through and fact check it, essentially. So I myself believe in using the power of AI, in terms of maybe doing something a lot quicker data analysis wise, as long as somebody is dedicated to checking what the output is. And I always tell students that I teach at the undergrad level that don't make AI think for you. Use it as a tool to kind of help edit, but don't. I wouldn't rely as much on the generative AI as much. But it's definitely in terms of social media a con of how quickly things can spread, how quickly AI can turn into our WebMD, and tell us what to think for science and for medicine. So it's just something that we have to kind of keep an eye on in the future, and currently really to make sure that we're not getting too lost in the weeds, that we don't get too far behind in terms of our science and medicine.
And you touched on this a little bit, but how has policy and politics directly affected you?
Um, I would say the biggest thing is funding. I have in the past couple of years, specifically with the NIH being shut down several times, grant reviewing periods are all sort of messed up. So you submit a grant that you thought was going to be reviewed months ago, and then the NIH shuts down, or leadership changes, or all of the NSF is fired. Then you're kind of like at the liberty of when these grant review committees are back up and running, and everything's delayed. So the funding is the biggest thing right now because you're essentially waiting for when everybody's back in session, when they have time, if it's all backlogged because we shut down the NIH. So I would say funding is the biggest thing that's affected, and grants, that are the government funding are the biggest thing that's affected really, by current policy.
And what can people do for policy change advocation?
Um, so I would say, everybody always has the cliche line of communicating with your representatives, and making sure that rare disease makes it to Capitol Hill. There are a lot of organizations that specifically gather to present to, our current government about, funding, about areas that we need to improve on. So getting involved in those types of organizations to make sure that it actually gets to stakeholders, to policymakers, enforcers, involved in any way that you can to kind of make voices heard, um, is a way that we can make sure that rare diseases don't go away. Um, but also, there are a lot of organizations, that people are finding that are private funding agencies that are not reliant on the government. They're reliant on, um, people actually donating money, or if it's a foundation like 503 um, organizations that are set up, that's also another way that you can kind of combat waiting for government funding, if you're able to find a nonprofit that actually allows for funding. So while we can continue to help try and make policy changes, and keep rare diseases at the forefront, we can also kind of tune in and try and find those nonprofit organizations that may have a little bit of funding to kind of tide you over until we're able to have a more stable economy in terms of funding for science.
Definitely.
And yeah. And are there any projects, initiatives, or organizations that you think would be useful to our audience or that you want our audience to know?
Um, I think there are a lot of organizations out there. So one of the organizations is Global Genes, which is rare um, disease that has patient consortia, so caregiver reported. Another one that I work closely with is the Simons Foundation, um, mainly for autism research, but they also have their rare disease cohort in the Simons Searchlight program. And I can actually compile a list of frequently visited sites that I have, if that's helpful for you guys, and for your audience, kind of like a little guide to rare diseases of websites that I visit often. I can put that together and definitely send that so you can provide it to your audience as well. Simon's Ultragenics, I think, is one of the ones that you guys are familiar with. Even if you Google a rare disease and you find a patient advocacy group, that's the easiest way to figure out how to get involved. And they normally have contact information for the rare diseases, but then also knowing somebody who's involved in it, who has those connections, is also helpful too, because they can easily kind of tie you to the rare disease organization. So patient advocacy groups, whether it's just figuring out their foundation's website. But then there are also a couple of more science-y based ones and patient data set ones that I can send you guys as well.
That'd
That
be
sounds
super
great.
helpful. Thank
Yeah.
you.
Yeah.
I guess kind of wrapping it up, where can people follow your work? And it's under my assumption that you are starting a new role in the next coming weeks. What will that new work entail?
Yeah. So I have, as of I think literally today, just signed a contract to be the research and program coordinator for Rowan Virtua's RISEN Center. RISEN stands for Regional Integrated Special Needs Center. That is a center of excellence for individuals with different or special needs. So whether that's autism, Down syndrome, anything rare neurodevelopmental. Um, I am hoping to kind of build up their research program there. And contribute my background both in bench science and clinical, um, to kind of bring the research to the forefront with that organization. So that position will mainly focus on actually education of current medical students, residents, and then also current physicians on how to care for individuals with special needs. So making sure that individuals are well equipped to speak with, to interact with, to care for individuals with special needs is something that's lacking from medical education curriculum. So I'm going to focus a lot of time on that, developing curriculum to help people better care for these individuals, but then also more of maybe the molecular genetics side of it, looking into genes that are associated with autism, genes that are associated with rare diseases, neurodevelopmental diseases, hopefully bring some of my expertise in that to the research program. So I'll be starting that Monday, actually. And then in terms of current work, I always continue to update my LinkedIn whenever I have publications that come out. So LinkedIn is a great place. Um, I think that's probably the best way for publications. I mean, I'm also on ResearchGate, um, PubMed, that kind of thing. If you put in my name, I'll come up. But LinkedIn is definitely the easiest way. Again, social media, the easiest way to communicate what you're doing, what you continue to do. Um, so if you, I'm okay with you guys providing my LinkedIn to anybody who's interested in reaching out with questions or anything like that.
Got it. Thank you. And is there anything else you want to add?
Um, I think that so I love this initiative. I love what you guys are doing, especially from I touched on it a little bit earlier, especially from a young age. This is not something that people even really start to think about until maybe the end of college. So the fact that you guys are already thinking about these kinds of initiatives so early on really speaks to your education, how great your education. I know you go to a very good school, but how great your education has and will continue to be. I think really equips you for the future and equips the future of OAI. Um, I think it's a really great initiative, and I love reading all of your updates that you guys put out there. There's a lot of thought and a lot of work that goes into what you guys put out online. And I've read everything so far. Hopefully, it's not like creepy, but I've read all the stuff that you guys have put out so far. And especially for somebody who's actually in the field, seeing young minds who are interested in this is it's very heartwarming to see that people are actually interested in this. And hopefully we'll continue the next generation because that's ultimately the goal of each new rising generation is to inspire the next and to kind of keep it going. So you guys are very inspiring. Even as somebody who's been in the rare disease space for a while, it's nice to see how much you value this space.
Thank you so much. It means a
Thank
lot.
you. Thank you. And
Yeah,
thank you so much for your time as well.
Yeah,
of
thank
course.
you.
Yeah.